Back problems and back pain commonly occur in the lumbar region. Each vertebra has an opening that forms the spinal canal and protects the spinal nerves. Facet joints and intervertebral discs connect the vertebrae above and below. These structures are held together by groups of ligaments and muscles. Muscles attached to the spinal column allow us to move, and they also support the spine, bearing the body's weight. If some of these muscles are tight, weak, or imbalanced, pressure can result in excessive wear and tear of other structures. For example, a common problem in the lower back is disc herniation. In this case, pressure on an intervertebral disc has caused its center, the nucleus pulposus, to protrude backwards and push against the spinal nerves, resulting in low back pain. Exercise can relax muscles and reduce pressure in the lower back structures. It is important to consult your health team to determine which exercises are best for your condition. For patients with posterior disc herniation, lying in a prone position reduces the pressure on the disc. If the pain condition allows, performing extension movements can gently stretch and relax tight muscles. Your lower spine also becomes more arched with time, bringing the disc center forward into the correct position and reducing the irritation on your nerves, therefore decreasing the pain in your lower back and legs. The benefit of exercising is more than just reducing the pressure on your lower back structures. By integrating back exercise into your daily routine, you can condition your abdominal and back muscles, referred to as core muscles, and therefore prevent low back pain from happening again.
Hey everyone, my name is Dr. Jeff Peng. This video will teach you a quick 5-minute stretch and exercise routine that will help provide relief for your neck pain. 5 minutes is really all you need to stretch out the neck, but the key is to do these stretches frequently, ideally at least 3 times a day. This way, you are slowly increasing mobility and range of motion of the neck muscles that often get tighter and tighter throughout the day. We'll first start off with a 1-minute warm-up. This will help get blood flow to our neck and our shoulder muscles. Then we'll work on stretching out the neck muscles by holding each stretch for 30 seconds. So for our warm-up, we're going to first work on some neck rotations. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And we're going to work on some side bends. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Going into flexion and extension. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then some shoulder rolls. So forwards, 1, 2, 3, 4, 5, and backwards, 1, 2, 3, 4, 5. So our first movement is our upper trapezius. So try to touch your ear to your shoulder, just like this. And what you could do to get a bigger stretch is actually to use this hand to put gentle pressure on your head. And what you're going to feel is a big stretch right through this area, right in your upper trapezius. Try to keep this shoulder nice and relaxed so that you can feel a big stretch right here in this area. And we're just going to hold this stretch for 30 seconds. And 30 seconds is up, and we're going to move on to the other side. So same thing on the other side, and now we just move on over and get a gentle stretch. And again, using that hand, you can put gentle pressure on your head to get this big stretch right over here, making sure you're keeping this shoulder nice and relaxed. That way you can focus the stretch on the upper trapezius. And we're going to do this side also for a total of 30 seconds. Good. In 3, 2, 1. Good. So our next exercise is our levator scapula. So look down, point your nose towards the opposite knee, use this hand and put gentle traction down. You're going to feel a stretch right here. And you can use this hand and raise it and put it at the base of your neck. And what that's going to do is that's going to lift your scapular border up to really isolate that levator scapula. And again, gentle traction with this hand pulling down on your head. And you're going to feel that stretch right here in this muscle. In 30 seconds, and we're going to switch sides now. So same thing, gentle traction down, lift this shoulder up, put your hand at the base of the neck, gentle traction down, and you should be feeling a nice big stretch right here in this muscle. Now the levator scapula is this really important neck muscle that forms a lot of trigger points, gets a lot of tension, especially if you're spending a lot of time in front of a computer or if you're in front of your cell phone all the time. You get a lot of tension here. So 30 seconds in 3, 2, 1. Good. So the next one we're going to do is our anterior muscles, our anterior scalene. So what you're going to do is try to touch your ear to your shoulder, and then you're going to look up. And what you're going to feel is a nice big stretch in the front, right over here. And we often stretch out all our neck muscles in the back, but we completely ignore all the neck muscles in the front. And if you have tight neck muscles in the front, it tends to pull you forward like this, which is not what you want. And so stretching the anterior muscles are also really important. And so 30 seconds, switch sides, so ear to the opposite shoulder, then look up. And now you're going to feel big stretch right here in the front on the opposite side. And again, you shouldn't be having any pain when you're doing this, but you should be feeling a nice stretch in the front right here. And we're going to hold this stretch for 30 seconds as well. In 3, in 2, in 1. Okay, good. So the next exercise we're going to do is called a chin tuck. So I'm going to rotate my body this way so you can see. I'm going to put my fingers on my chin, and I'm going to retract my chin towards my neck. Like that. And you want to hold that retracted position for 2 to 3 seconds. And we're going to do this for a total of 30 seconds. And this can really help strengthen the neck muscles that get weaker and weaker over time. So this is really good exercise for the neck. Good. And that's it. Very simple stretches and exercises.
Now, what I like to do on the foam roller, it's got a 6-inch diameter on it, and it's a 36-inch length. I like the longer length because you can do exercises like this on them. I'm going to actually pop up onto that foam roller, and so my butt is on there, and you can see that it supports the entire length of my spine. Now, option A is you can actually just lay here and let gravity take over, let gravity kind of pull your shoulder blades down and back. Or I like to make it a little more dynamic. I like to involve my arms, and so we can do these big kind of arm arcs. So up and over your head and then right back down. I would spend about a minute doing that. And then we can also do what I call them foam roll angels. And so we're right here, my wall's in my way. And so we're right here going through these big arcing motions. If you're down on the floor, I tell people try to keep your knuckles down on the floor. You're going to have to engage your shoulder blades, pull your shoulder blades down and in order to get that motion. And I tell people to spend about a minute doing that as well. Now, if you don't have the foam roller option, you can also do what we'd call a doorway stretch. Simply come up to a doorway, put your hands on both sides of that doorway. Now maintain a nice, good, upright posture as you lean forward. And as you lean forward, you should feel a good, comfortable stretch through the front of your chest, through the front of your shoulders. Take it as far as you can comfortably, hold it for 20 seconds, and then repeat that 3 times. That's a good alternative.
Put some counter pressure against the neck.
So she can pull
it that way, yep.
Gently.
And just start working on extensions. Now you can have your back up against a chair too, especially if you have a decent chair with a decent back.
Now, did you have her hold here or a little bit?
A little bit of both.
Yep.
Whatever felt comfortable. That whatever was letting her extend back, That's what we're doing.
So typically, you'll go back a little farther. It feels better with the support, and it may take a few repetitions or even more, throughout the day before it starts to really go back. And the pain goes down with the range of motion as it increases. Typically,
it immediately helps some,
mm-hmm.
and then over the course of the next day or two, it went away. But in addition to that, what you can also try is you can try some rotations. Brad, do you want to go ahead and try those?
Sure.
Show the opposite way now. These one's going to go turn to the right now, so you're going to pull down on the right one, and there he goes to the left. Or right to the right.
Notice I keep the towel up here so it goes across my jawbone and not your neck.
Yeah, exactly.
Yeah. Really critical thing.
It just gives nice support for the neck when trying to do this, and it works real well. If it hurts to rotate that way, you might actually work on rotating the other way in order to, and then go back to the other one eventually.
Right.
It seems like that really helps.
Yep.